Good afternoon. My name is Dr. Lauren Bennett, and I'm a clinical neuropsychologist here at the Pickup Family Institute for Neurosciences. Thanks for joining us this afternoon as we discuss part 1 of our series of practical memory strategies. We'll dive in. What I want to begin by highlighting is that some changes are to be expected as part of the normal aging spectrum. So you may have noticed that your thinking and your cognition overall has slowed a bit with time. And to an extent, that is to be expected. We all may have difficulty recalling the name of, say, a movie character or the name of the actor who played them. What's atypical is more routine or more repeated difficulties with memory, like coming up with the names of folks you know well, or perhaps recalling a recent conversation that you had with a loved one about an important topic. If you suspect that your memory changes or thinking or memory changes broadly might be impacting your overall cognition, we would encourage you to speak to your primary care provider or any of your treating providers about those changes you've noticed. So if you feel like they're out of step with your peers, your memory changes might be beyond what you would expect for normal aging, it would be helpful to have a conversation with your providers to see if it might be appropriate for you to undergo further assessment. We also offer a program here at Hoag that I'll mention now and at the end of our time together called the Orange County Vital Brain Program. And this program offers an objective cognitive screening for individuals who might have concerns about their overall cognition. And it's a helpful starting point to know what might be the appropriate referral for you or to monitor your changes in your cognition across time. Let's talk about the things that can impact our cognition, starting with our lifestyle support. So what we know from the research is that about half of our risk for developing a dementia process or a neurodegenerative disease is related to lifestyle factors, while the other half, broadly speaking, is related to our genetic predisposition. So we'll talk through some of the lifestyle factors that can have the greatest impact on preserving brain health. As we talk today, what I'd like you to do is take a piece of paper out and jot down 3 areas that you feel like you're doing particularly well in, and on the other half of the paper, note down 3 things where you feel like you could improve, 3 areas where you might be able to make improvements. And then we'll talk more specifically about the plan of attack to make those improvements. The first area I want to discuss is physical health. So, some practical ideas about how to encourage your overall physical health. And many folks have some questions about how their physical well-being might be connected to their cognition. But if you think about it broadly, our brain is part of our cerebrovascular system. So anything that might impact your heart health, good diet, good exercise, is also going to impact your brain health by making sure that the blood flow is getting as healthy and well distributed as possible across all aspects of your brain. With that in mind, one piece that I first want to begin with is the importance of managing any chronic health conditions. This might be things like diabetes, high blood pressure, high cholesterol, any kind of chronic conditions that might be impacting you. It's very important to be proactive about your health. Also to that end, taking all medications as prescribed. So if you have been provided any medications, it's important not to make any adjustments on your own without discussing with your primary care provider or the prescribing provider. Try not to make your adjustments to your medications independently. You don't want to titrate or adjust your medications up or down without first having a conversation with your providers. I also want to encourage you all to be proactive about your health care. So it's very important to stay up on all of your medical screenings and appointments. For many folks, that includes part of our Orange County Vital Brain Program is coming in to get that annual checkup. But more importantly, overall, keeping up to date with all of your conditions, just as you would, say, go to a routine physical, making sure that you're having those conversations with your providers if you do notice any changes, even if it's early. What we know from the research is we have the greatest ability to impact the course or progression of a neurodegenerative disease or a difficulty with your thinking or memory broadly if we catch that kind of thing early. So it's very important to be proactive. Take notes, bring in your questions and your thoughts, and share them with your providers at your earliest opportunity. And to that end, just make sure that you're keeping up with all your medical appointments and your annual physicals, just like you would, hopefully, your routine teeth cleaning. Next up is nutrition. So, as we mentioned, very important to manage all cerebrovascular risk factors and your overall physical health. Think of nutrition as the nutrients that fuel not only your body, but your brain. In fact, we actually know that a lot of our calories, our daily calories, actually go to fueling our brain. So believe it or not, the more you're doing in terms of your cognitive activity, the more calories your brain actually burns. One diet or approach that's often a good fit for folks is something called the Mediterranean diet, which you might be familiar with. It involves a lot of good fats or proteins like fish or lean meats. It's low in red meats, very low in processed foods, high in whole grains, and high in vegetable content. A spin-off of that is something called the MIND diet, which is a combination of the Mediterranean and the DASH diet. Both of these are commonly prescribed by providers for folks who have noticed any kind of cognitive difficulty and or cerebral vascular risk factors. So I would encourage you to talk to your primary care provider or any of your other providers, a cardiologist, neurologist, to see if one of these diets might be appropriate for you. But the big picture takeaway is less processed foods, good whole foods, lots of veggies, low on the red meat content, and high on good fats and proteins. To that end, very important to select nutrient-dense food. So, just as our heuristic a moment ago, more processed foods are more empty calories, generally speaking. So we want to encourage as much consumption of high nutrient-dense foods, those whole foods that will really help fuel your brain and your body. One practical idea that I'd like to encourage you to take a risk on, take a little fun with, is to try out a new recipe or a new cooking class. Before we got on camera over here, we were actually discussing some potential recipes for our Valentine's Day plans, because so many of us will be celebrating from home. And I will be honest, they weren't the healthiest options. There was some mac and cheese involved, definitely some red meats. But what I want to encourage you to do is there's lots of healthy, wonderful options out there that you can do some research on to see if there might be a new, fun way to incorporate some of these nutrient-dense foods. And we'll give you a pass on Valentine's Day if you're planning to make some mac and cheese like we were. But outside of that, give a new recipe a try. Hogue has a wonderful YouTube channel that has all kinds of great cooking demonstrations, and a number of the different magazines, outlets are doing heart healthy and heart conscious recipes for the month of February, since it's our heart health month across the country. So look for those and try out a new recipe or new plan that might be a new favorite of yours. Next up is physical exercise. So I often get a lot of groans when I mention this one. I know it's not the easiest thing to incorporate, but it's so important, not only for your physical health, also for your cognitive health, and certainly for your emotional health as well. So this is not new information, but let's break it down into practical strategies here. The goal is to aim for 30 minutes of exercise 5 days a week. I know that can feel very daunting, but the thing I want you to think about is how to incorporate this into your day. So it doesn't need to be 30 minutes all at once. It might look like 3 10-minute walks around your block, one in the morning, one over your lunch break or lunch hour, and one in the evening after dinner. That's a great way to break it up so it doesn't feel so daunting in your day-to-day life. Also, it can be little things, parking further away in the parking lot. It can be walking up the stairs to use the bathroom on another level, or going back and forth while you're cleaning your house, going up and down the stairs as many times as possible during that clean. Those little things really add up to an overall lifestyle change. And trying your best to sneak in the physical activity so it doesn't feel so cumbersome, that's a great way to ensure that it makes it into your day. As mentioned, it's been a really tough emotional period for a lot of folks with the pandemic as well. So incorporating some physical activity early in your day, getting that exposure to sunlight, if you're able to go for a nice walk around your neighborhood or a bike ride, perhaps a swim if that's an option you have available, trying to incorporate it early in your day will have a nice impact not only on your metabolic effects for the full of the day, also on your mood though and your cognitive functioning. So you might notice an improvement in your processing speed throughout the day, and your memory might be a little sharper if you are able to sneak in that morning exercise. I also want to encourage folks to incorporate stretching as well as strength exercises in addition to the cardiovascular exercise we were discussing. It's very important to making sure that you stay healthy overall and supporting, again, not only your physical health, but also your cognitive and mood health. So don't forget to incorporate that stretching and strength exercise into your daily routine. And that, again, can be a little thing. One of my favorite tricks is to stretch while brushing my teeth. True story, I absolutely do it. But while brushing your teeth, you can put your foot up on the edge of a bathtub or a little stool you have available. It's a great way to make sure you're brushing your teeth for the adequate amount of time, and also a nice way to sneak in some exercise. But I've heard lots of different great ideas about how to do this. For some folks, it might be doing lunges while they wait for the 30 seconds to heat up their meal, for example, on the microwave. Anything that sneaks into your day would be a wonderful way to make it happen. We also have some really great virtual resources available. Again, I'll point you towards Hoag's YouTube channel as a starting point, but there's a multitude of different options all across the internet, depending on your preference and interest. We also have some really wonderful chair stretching programs, yoga programs, chair yoga as well, if that might be a more limiting in terms of what you can do physically. So give it a look and see if there's an exercise routine that might be appropriate to incorporate into your day-to-day. All right, next up is what we call intellectual exercise or cognitive activity. So this might look like different things for different folks. The best advice I can give here is to find something you actually enjoy. If you enjoy it, you're far more likely to actually incorporate it into your day-to-day. For some folks, it might look like puzzles. It might look like a book club, so getting together with friends or loved ones, reading a book and discussing it periodically throughout, or online academic courses. Many of the courses in light of the pandemic have moved to online, so there's really wonderful, interesting, often low cost or no cost for older adults options available through senior centers, local community colleges, and other higher learning institutions. I would encourage you to find something that excites you. Maybe you've always wanted to take that Italian class for that trip you're planning in 2022 when it's all safe to travel again. This would be a great time to look into that. Intellectual exercise is best if it's giving you a true mental workout here. So we want to find something that's going to be a novel problem for you to solve. Learning a new skill is a great example of that. For example, if you once played piano and you haven't played in 40 years, but there's always been that part of you that thought you might get back to it, now is a great time to get into that. Trying to find a way, a new skill, a new hobby, a new musical instrument, a new language, something to give you that mental workout day to day. There also are available these brain training apps. You may have heard of some of them. Luminosity, for example, Cognifit, Cognimed. I've listed a few on the slide here, some of which are entirely free. Some of them have a subscription plan. So whichever one you like, there's many of them you can check out and see what might be the best fit for you. But the goal here is anything that you're actually going to do. So if you're the kind of person who always has their cell phone with them, try to find one that works on a cell phone. So you might be able to pull it out in the middle of your day while walking, and if you had a moment to sit down and take a rest, you could do it in the middle of that activity. Or if you want to do something more formal on a computer, there are some that are optimized for your computer as well. But again, the goal here is to find something you'll actually do. If you're a bit more competitive, I will say some of these apps or programs allow you to compete against loved ones or friends, make it a little competition, if you will. That might be a good start for you. Next up is sleep hygiene. So we all know that we should be getting around 8 hours of sleep, but very, very few of us are actually getting 8 quality hours of sleep. What do I mean by quality? I mean solid, unfragmented sleep. Now, it's not atypical, especially as we age, to get up to use the restroom during the middle of the night. That's not a problem. But what is a problem is if you have extreme difficulty falling back to sleep after you get back into bed. So if it's taking you longer than 15 minutes to fall asleep when you first lie down or after you get up to use the restroom, then we're considering that that's a difficulty with either sleep initiation or onset or sleep maintenance throughout the course of the night. So how do we address this? Well, first of all, this might seem overly simplistic, but making good quality and good quantity sleep a priority. That means you have to actually build into your schedule adequate amount of hours for sleep. So being really protective, really mindful over those 8 hours. I'll also say here that some folks generally need closer to 7 hours. Other folks might be a little higher, close to the 9-hour range. You know your body best. Whatever it is that you feel best on in terms of how many hours of sleep you actually need, do your best to protect that window then and really ensure that it's a priority in your day. Protect it just like you would a doctor's appointment scheduled on your calendar or any other commitment. Really get defensive over that. So no television, no reading, no conversations, no cell phones sneak into that window. Next up is practicing good sleep hygiene strategies. So one of these I just alluded to, but as you might have guessed, the rule is no screens in the bedroom. That's right, none. Absolutely none. No cell phones, no TVs, no computers. As much as possible, try to power everything down 1 hour before bedtime and while attempting to fall back to sleep if you do wake up in the middle of the night. Bonus points if you use your phone for an alarm. Bonus points if you can set the alarm and leave it on the other side of the room where you can't easily reach for it. Why? Why is that such an issue? Well, we know from the research that one of the worst things we can do for our sleep is actually checking the clock in the middle of the night. So, rule number 2, no clocks in the bedroom. If you need a clock to set your alarm on, that's totally fine. See if you can turn it away from where you can see it, put it under the bed, in a drawer, cover it with a t-shirt, whatever it takes, but I don't want it to be visible throughout the course of the night. We also want to set normal wake times and normal sleep times, trying to hold those even on the weekend. So going to bed at the same time every night, getting up at the same time every morning, and really again being fastidious and protective over that time window. We also want to limit naps to 30 minutes before 3 p.m. No naps outside of that window, and I would even prefer that there would be no naps, period, especially if you're under 90. If you're over 90 or over, I'll give you a pass, you get 1. But if you're under 90, I would really prefer no naps at all. It decreases our sleep pressure, and then we don't have adequate sleep pressure built up in our brain to help us support the good quality sleep that we need at night. And if you're taking any sleep medications to currently help with that, I would encourage you to have a conversation with your provider about making sure that those medications are not changing your sleep architecture, meaning your ability to drop into the different stages of sleep across the night. Things like antihistamines and some of the medications we use for bladder control, for example, can be some of the medications that can negatively impact our sleep architecture. So it might be a good conversation to have with your primary care provider. If you're experiencing any abnormal sleep behaviors, this might be like snoring loudly, being observed to stop breathing for periods of time during the course of the night, difficulty falling asleep, difficulty staying asleep, sleepwalking, sleep talking, or acting out your dreams, I would encourage you to ask your primary care provider if a sleep medicine consult might be right for you. We have a wonderful sleep medicine program here at Hoag, and I would strongly encourage you, if you're having any of these difficulties, to get that managed earlier rather than later. What we know from the research, particularly in the last 20 years, is that sleep is way more intertwined with our risk for developing dementia than we had initially thought. So it is literally essential to your brain health. So do not wait if you're having any difficulty with your sleep. Please be proactive about starting those conversations. Next up is social engagement. And this one's a bit of a challenge, admittedly, in the midst of a pandemic, but I want to encourage us all to get creative. Interestingly, we know from the research that cognitive activity, physical activity, and social activity are really key and really important. So making sure you get all 3 of those, better yet if they're intertwined throughout your day, is super important. So what are some ways that we can get all 3 of those with one stone, right? One activity. So a good example might be, like we said, enrolling in a class online where you have the opportunity to have discussions, listen to lectures together, and then use the material. Practice your Italian since you're now going to sign up for that class. Having those book clubs or book discussions, those regular meetings with your Bible study or religious group, anything that gets you connected with people in a safe way is super important for preserving brain health. This one often gets a bit missed, but we know again from the research that it's essential to brain health as well. So some practical strategies are staying connected with friends and family, taking the initiative, reaching out, scheduling those regular phone calls or Zoom calls. You could also consider joining a local community or volunteer group, many of which are meeting online, obviously, given the current circumstances. There's lots of wonderful ways to get active and get engaged. Many of the senior centers here in Orange County have just done a phenomenal job about shifting their programming to online. So those are a wonderful resource, a starting point in terms of considering what programming and offering is available. Many of them are starting back up for the spring here in the coming weeks, so I would encourage you to check out their programming. There's also a number of virtual options for groups and appropriate volunteer opportunities. I've listed a few of them here, so meetup.com, Volunteer Match, Instameet, Nextdoor, and Active. Those are different online platforms where you can go to participate in various groups, many of which are volunteer opportunities that you can do remotely. So letter writing, phone banks, campaigning or championing for causes that might be important to you. Whatever it is that you're passionate about, I would encourage you to look for opportunities to get involved. This also touches on a second piece that I really want to highlight here, which is finding a sense of purpose. For many of us who've worked very hard throughout our lives, when we transition to retirement or perhaps are no longer raising our families, it can be hard to find that same sense of purpose and day-to-day significance. I would really encourage you to think about what activities will be most meaningful for helping you feel like you're really connected, giving back, making a meaningful difference and contribution in your day-to-day. Again, we know that sense of purpose is absolutely incredibly important for preserving brain health as long as possible. So trying to find a way to speak to that desire, that need for purpose will be very helpful. And last up, as we mentioned, there's lots of unique ways to do this. Some of them can be fun too, not to make it too serious. But like we said, online discussion groups, book clubs, trivia games, getting in creative in terms of what and how you connect with folks is always the best advice there. Next up is mental health care. So as I mentioned, mental health care is absolutely a key and integral part of our overall cognitive wellness as well. So they're not disconnected by any stretch of the imagination. As many of you might have experienced, when we're feeling down or blue or anxious, we notice a direct impact on our ability to think and recall, so our cognition broadly. With that in mind, the research also bears out that folks who experience both depression and anxiety are at an increased risk for developing a neurodegenerative disease later in life, or if they're an older adult at that point in time. So managing and properly caring for your mental health is one key piece of the puzzle and not to be overlooked. So what are some practical ways to do that? Well, if you're experiencing any symptoms of depression, anxiety, or other mental health concerns, please be proactive again about speaking with your provider. There are a number of wonderful resources available: talk therapy, support groups, community groups, medications that can all support your overall sense of well-being and again help preserve your brain health and cognitive functioning. I also would encourage you to reach out to any resources you might need proactively. So oftentimes folks don't wait until the symptoms are severe enough, rather they will wait until the symptoms are more severe to reach out. But I would encourage you to be proactive about it. Taking these steps to put in this community, put in these activities, will actually be one piece of making sure that you maintain good, positive mental health care overall. I would also encourage folks to consider how to incorporate mental health wellness into their day-to-day routines. So that's part of that proactive care piece we were discussing. Super important. For some folks, it might look like regular journaling, meditation, putting in support or community groups, regular check-ins with family or friends. But again, not waiting until it's already an issue or certainly not a crisis, but being proactive about making sure there are mental health supports throughout your day. And I'm going to pause here. I've got a few questions, and we'll address them here. So we're going to talk about sleep. I always knew that's a popular one here. So why should you not look at the time when you are waking up during the night? It's a great question. So what happens when you look at the time? Answer to yourself here. Yeah, most of us, we start calculating, oh gosh, I need to be up in 4 hours. I need to be up in 3 hours. I need to be up in 2 hours, right? So what is that doing? That is cueing part of our limbic system, the part of our brain that is quite activating in panic mode, right? So along with that, it's going to actually have a negative effect on the quality of our sleep and make it much more challenging to fall back to sleep. If you wake up in the middle of the night, the rule of thumb is it's sleep time. That's what time it is. It's sleep time. And your alarm is set so it will tell you when it is wake time. Other than that, it's important not to look at the clock so that your mind doesn't start activating on that cycle. And another question is, this individual doesn't sleep as well when they wear their CPAP. They wake up more often. Any tips to help with sleep apnea? Yes. So CPAP machines are quite a bear. I will not make any pretense about that. With that in mind, they are evolving constantly and getting better and better. If your CPAP mask is uncomfortable, talk to your provider about it. There may be other options. It's like a pair of shoes. Just because it fits me and works well for me does not mean it's going to fit you and work well for you. There are a few options, like we said, so be proactive about talking, trying them out, seeing if there's a shift might do a world of good for you. To that end, though, it is extremely important that if you are diagnosed with sleep apnea, that you use your CPAP machine religiously. The correlation between cognitive health and development of a neurodegenerative disease, super important that you're treating your CPAP or your sleep apnea proactively with your CPAP and using that machine nightly, because there's a much higher risk for individuals that don't treat it. That's one of the biggest risk factors for onset of cognitive decline. So do keep fighting, keep being proactive about it, keep looking for a different mask that might serve your needs. All right, so we'll pause here. If you would, hopefully you've been jotting down a few notes about things you're doing well and things you could improve. I'll ask you to take a moment here and look through your list. What are the 3 things that you feel like you're doing best of the areas we've considered? And where are the 3 areas that you could do better? Few thoughts on how to make changes on those 3 areas you'd like to improve. First up, start small, right? You're not going to run a marathon tomorrow if you're not an exerciser. Maybe the goal is that 3 times a week you go for that 10-minute walk. Tomorrow is not going to be perfect, right? So we want to start small, incremental, measurable goals for progress. Setting those realistic goals, writing them down, and then making a schedule. So if the goal is to walk for 30 minutes 5 times a week by 3 months from now, make a schedule to get yourself there. Starts with 10 minutes a day, every other day for the first week, gets more frequent from there, and you work your way up. But tomorrow is not the day where you're going to go run a marathon, right? And then focus on each of these areas one at a time. So you've got your list of 3 different areas that you want to improve upon. Don't try to make changes in all 3 simultaneously, but instead master one goal and then the next. If it's a longer-term goal, like our 3-month exercise goal, make sure you've got a solid start on that goal, maybe a month under your belt, and then you could incorporate the second goal if you feel like you've got a solid handle on that first one and it's well underway. All right, a few resources I want to share here, and then we'll answer a few other questions. There are a few mental health resources I wanted to make you available of, since a lot of folks are experiencing more mental health distress in the context of our pandemic. So we've got the NAMI WARM line, which is an available toll-free number that you can call. The time's listed there. It's specific to Orange County, and there's also a toll-free mental health nationwide line listed underneath that. That's part of our Substance Abuse and Mental Health Services Administration number. Either of those are wonderful resources for both. Top one is non-crisis support for mental health. The bottom one is more disaster or distress help. So there's more crisis needs. There's also a wonderful hotline that's available to connect you with mental health resources in Orange County, and I've listed the phone number there. If you're experiencing any thoughts of wanting to harm yourself, I did include the phone number for our national suicide hotline. We're seeing a huge uptick in the folks that are experiencing suicidal thoughts. If that's you, absolutely no shame, but do reach out to these organizations and get connected and get the support you need early. I've also listed a few different substance abuse group offerings, many of which are now shifting to online options or remote options broadly. So both AA and NA are listed there. And then a few other mental health resources that I want to make folks aware of. There has been an uptick in intimate partner violence, or what we think of as domestic violence. So there's a phone number listed there. And then there's a wonderful resource guide on the NAMI OC organization website that has a number of different community, financial, general resources that are available for anyone who might be experiencing stressors, either related to the pandemic or just in general. All right, and if you're experiencing any memory changes that you think exceed normal aging, I will encourage you to follow up with your treating medical providers. We also, again, have the wonderful program here at Hoag, the Orange County Vital Brain Program. That's a great starting point if you want an assessment of where you're at cognitively and you'd like to monitor your changes across time. I've listed the website there for more information. All right, and so another question about sleep. I think we hit a topic there that's quite popular with folks. Is it okay to take melatonin? Any safe quality? So, yes, melatonin is a naturally occurring substance that happens within our brain. The supplemental melatonin can be quite helpful, and the research on it is very positive. It is most effective when taken 90 minutes to 2 hours prior to bedtime. You can't take it at bedtime and expect it to have the desired effect. It's a bit like the thing that primes your brain for sleep. So you need to take it early, and then it will cue your brain that it's time to start shutting down and slowing down overall. In terms of the quantity, I'll direct you to your primary healthcare provider to have that discussion, or if you have a sleep medicine provider. But generally, they'll have a good sense if there's any reason that you shouldn't take the recommended amount on the over-the-counter supplement. So have a conversation with them about that. And a recent study suggested that 1 glass of alcohol and eating some cheese daily helps keep dementia away. Do I agree? Wow, I would love this to be true. I really would. So I think I might know the study that this individual is referencing. There was a study that infamously linked champagne drinking to cognitive health. However, there was some confounds in there. So unfortunately, the confound or the complicating factor in there is that folks who can afford a glass of champagne and nice cheese might have other socioeconomic advantages like access to good health care, more preventative medicine access, that actually might be the reason that their overall cognitive health is improved. So that said, well, let me tell you what there is on the research. Generally speaking, 1 glass of alcohol per day is what we can handle when we age into the 65 or 70 year range. More than that, and is a challenge for our liver once we get into that age bracket to effectively metabolize. So 1 drink a day. More than that, you're going to have, of course, potential risks for falls, cognitive slowing, the other pieces of it. That said, many of the medication that a lot of older adults are on can have, of course, adverse side effects with those interactions with your medication and the alcohol. So please, please, please be sure to talk to your primary care provider to make sure that alcohol is a safe choice for you. All right.
Okay, there's another one, if you want to repeat it, because it's a little long.
Sure.
Okay, when I wake up, I do calculate the amount of time I still should sleep, and maybe take something to assist me in getting back to sleep if I am awake for too long, melatonin, sleeping pill. How would I manage this if I don't know the time?
Yeah, so the question was, this individual wakes up in the middle of the night, calculates how much time they have left in their sleep window before their alarm is going to go off, to determine if it is appropriate for them to then take melatonin and or a sleeping pill. So broadly speaking, sleeping medications are not long-term solutions that we want folks to be on. They can have negative cognitive side effects and increase your risk for developing dementia down the road. Melatonin is not one of those substances, but I'm talking about things like Ambien, for example, or Lunesta. So those medications do have a negative impact on your cognitive functioning overall, and long-term they change your sleep architecture when you are sleeping, so you're not getting the good quality sleep that you need. So with that in mind, I would encourage you to keep working with your treating providers to make sure that you're managing as much of the sleep difficulty through what we call sleep hygiene and sleep restriction. We offer a wonderful course here at Hoag that is a cognitive behavioral therapy for insomnia 6-week online course. It's available for anyone. It reviews these exact structures that we were just talking about. So what's called sleep restriction and sleep hygiene and the stimulus control. Those are the tenets of what we call cognitive behavioral therapy for insomnia. It's available on our community education page. Again, it's totally open to anyone. There's no referral needed. It is $300 to enroll in the 6-week course to cover their provider's time. But that's available, and the next one is actually starting February 16th. It runs from 5:30 to 7. I know because I'm one of the providers who has the great privilege of helping to teach that course. So with that in mind, that might be a great starting point, or talk to your primary care providers about available resources for you. We really want folks to not be on these long-term medications in terms of the negative effect for their cognition. So if you're making that calculation, there's a larger issue we need to address, which is your sleep overall. That said, I do understand the calculation of the sleep medication within time, and that would be a conversation to have with your treating provider about whether or not you should be taking that medication in the middle of the night if you do awaken. All right. I appreciate you all joining us for part 1 of our Practical Memory Strategies conversation. Looking forward to seeing you back here tomorrow at 4:30 for part 2. Have a wonderful evening.